Happy Tuesday! Time for Tidbit Tuesdays. Last week I talked about networks and providers and networks. This week I'm going to tackle your prescriptions and networks. So the frustration that I've had a lot of people have is, we look up to see where their meds are covered, and most plans now are gearing toward they will cover those basic generics, tier 1 drugs. Will be covered before deductible, no matter what kind of plan you have. A vast majority of plans are not covering the other tier level of medications, tier 3, tier 4, tier 2, and specialty, until you meet your deductible. And then it's a percentage or a copay or whatever the case may be. Checking the formularies, which again, this is another tedious process, but that's why I ask you about your medications, because I'm having to find that I'm having to do more research for you to find out where your medications fall and what you would expect to pay. So yes, you can search the formulary, which is good. You also need to search what are the preferred pharmacies. There are many plans out there that will use Walgreens and not CVS. You can use H-E-B, maybe not Randall's. Costco may be a network. Walmart may be a network. You need to know where to get your prescriptions filled. Then the other kicker, of course, is the cost. Because now if you're stuck, you need XYZ medicine and it's not a basic generic, well, how much is this going to cost me? So a couple options there. First, H-E-B has a really great program, a cash pay program, that does work for some people. In a lot of instances, their pricing is cheaper than GoodRx. So that's one thing to do. The other thing to do is to look at GoodRx. So not only does GoodRx give you a coupon, and there's a level of GoodRx you can buy up to the next level you pay, I don't know if it's a yearly or a monthly fee, to have better access to better deals. You can check. It does allow you to check to see what your medicine would cost on the higher plan, on the plan you pay for. But if you have a brand name med that does not have a generic, there's a good chance too that there's a manufacturer coupon. And those could be very cost savings. Now, a lot of them have limitations about how much you're allowed to use. Sometimes it's you can do 10, 30-day supplies. Or they'll pay, your copay is $0 up to the cost of $3,500. If you have a very expensive medication, that may not go very far. But there are definitely different options to explore to see what the best cost savings is. So what I try to remind my clients is that when we're searching plans, I try to take into account how much your premium is, plus what you're going to pay out of pocket to use your coverage. So if it costs $300 more a month to have your prescription cost $20, but if you pay the lower premium and your prescription costs you $50, that's cheaper. And so we have to kind of do the math to see what makes sense and remind people that's what we're doing, right? Because if you're used to paying $10 and now your prescription's $50, you may not like that, but that still may be better than paying an extra $300 a month to get that $10 copay. Again, it's a math problem. So again, utilize your portal, look up your stuff, and let's figure out the best cost-effective way for you to get your medications filled. Until next week, peace out.